Perfect. It looks like folks are starting to slow down coming in. So hello and welcome everyone to today's webinar on using data to leverage opioid settlement funds. As we do this introduction, it'd be really great if folks could introduce themselves in the chat, just giving their name, their county, and their organization. So in today's webinar, we will walk through the opioid data dashboard on children and families, as well as hear insights on how counties are using opioid settlement funds. By the end of this hour, we hope you will gain an understanding of how children and families have been impacted by the opioid epidemic, see how the opioid data dashboard can be used to inform local decisions about funding, learn how counties are using county-level opioid settlement funds to address the epidemic, and also hear tips on how to connect with your local elected officials about these funds. Before we hop into today's webinar, I do have a couple of things to touch on. So first, for those unfamiliar with Kentucky Youth Advocates, we are the independent voice for Kentucky's children and work all across the state on a broad range of issues with the goal of making Kentucky the best place to be a kid. My name is Corinna Cash, and I am the Data and Research Director at Kentucky Youth Advocates. And I am joined today by my colleague, Tara Grisham-Goodwin, who's Kentucky Youth Advocates Chief Impact Officer. We are excited to also have our partners in this work, the Kentucky Association of Counties, joining us today to help present in this webinar. Lauren Carr, the opioid settlement advisor at the Kentucky Association of Counties, will be talking towards the end of the webinar about what counties are doing and ways to engage with your local officials. Second, as we go through this webinar, you may have questions or comments that come to mind. Please feel free to leave those questions or comments in the chat. We will try to leave time to answer comments or questions at the end, but my colleague Lauren Bowling will be monitoring the chat and answering questions throughout, and we will also follow up via email on any questions that don't get answered. With all of that out of the way, I will turn it over to Tara Grisham-Goodwin to get us started.
Good morning, everyone. Thank you for joining. We're happy to have everybody here today, and I'm going to kick us off with a little bit of an overview of the purpose of the dashboard, how it came to be, and then delve into some of the features that you all can use on the dashboard. So as the opioid settlement fund distribution was beginning in Kentucky, we noticed that a lot of the focus was on treatment and preventing overdoses, very important work. But we at Kentucky Youth Advocates also recognize that with this unique opportunity of having funding available for a number of years, we had a true opportunity to make an impact on prevention. So preventing the next generation from becoming addicted to drugs or opioids specifically. And so we wanted to offer data and information to community members, and specifically county leaders too, who have county funds to disperse. Our intent is to put data out there, make it easily available on various ways that opioids impact our children and families, and also on ways we can prevent that impact from occurring, with the intention of influencing how opioid abatement dollars are spent and giving information and resources to people who are making those decisions. All of that is with the intent to create a brighter future for our state. And if we can move to the next slide, please. What you'll find on the dashboard is information on a whole range of factors that kind of span the prevention spectrum. So this goes all the way from what we call primordial prevention. I did not come up with that term, but it means preventing the risk factors for substance use. So environmental things and the community factors that make it even more likely that somebody might engage in substance use. It includes information about preventing the initiation of substance use. So how are we keeping youth from beginning? Once someone is using, how do we recognize that and intervene early so that we can prevent substance use from worsening? And then how do we prevent the long-term harms and fallout for substance use? and specifically opioid use. When we think about that in the context of children and families, that may mean trying to prevent and support families to prevent children being removed from the care of their parents. We'll move to the next slide, please. One of the things I wanted to share as well, and this is from our Bloom Kentucky initiative, is that in addition to all of the maybe data points that are more concerning, we also tried to include data points that showcase some of the positive experiences. If you're not familiar with the Bloom Kentucky initiative, you can find more about it on our website at kyyouth.org. But I wanted to share this information about how positive childhood experiences can have a true buffering impact, protecting kids from engaging in substance use behaviors later. Specifically, if you take a look at the lower half of the slide, you can see that those who reported the highest level of PACEs, which are positive childhood experiences, they had a 71% lower chance of using illicit drugs over their lifetime. That's really important as we think about what we can do as community members and how we can invest our dollars. With positive childhood experiences like having a connected adult in your life and engaging in activities at school or in the community, that can really buffer and protect young people from engaging in substance use in the future. And the next slide, please. So on the dashboard, I just want to give an overview and then we'll delve in. You're going to find data on issues related to prevention across that whole spectrum. So prevention in the sense of what are risk factors that might make it more likely for a person to engage in substance use, all the way to what are prevention measures and data points about reducing the harms that can come from substance use. And we've paired that with examples of what some of the counties across Kentucky are doing. We wanted to share and highlight some of the positives where we have communities that are stepping up and taking those measures, putting those measures into place already. Hopefully those can be idea generators for those of you who are interested in addressing a specific area. We also include, you'll see at the bottom there's an example of it, ideas for action. On every page, we wanted to share a specific idea that somebody could take and implement to address one of the data points shown on the dashboard page. And finally, we included a table of resources. So these are all, everything in the table is a resource or an example of a program, a project, or an idea that you could follow up with, look into more, and implement potentially in your community to address one of the data issues that you might find. So with that, we'll go to the next slide. And basically, this is just going to jump us into the dashboard itself. Corinne is going to pull that up. Just give us one moment. We will drop if we have, oh, right. Lauren has put the dashboard link in there for you. You're welcome to play along on your own over there if you would like, or I'm going to highlight a couple of things that we wanted to focus on and highlight for you. So if we jump to page 12, I was going to highlight for you all, page 12, we have some of the data points on reducing the long-term adverse impacts. So this is looking at ways that children can be impacted when there's opioid use in a home. Specifically, when we're looking at, when we put the pages together, what we were hoping was that counties could take a look at this. You could look at your county data for an indicator. And on the left in the map, you'll see that the data shown here is non-fatal drug-related emergency room visits for children under 18. So for each county, if you hover over the county, map, and maybe Corinna can do that for us now, you can see the data point pop up. So the county is identified, and you can see what the rate is for your county. Ways that you can look at that and use that data are to compare how your county is doing relative to neighboring counties, relative to counties in your area development district. And in some places, we also have a comparison for the state as a whole. So the dashboard is interactive. We want people to be able to look at it and delve in and get more information. Over to the right, you can see that there's a drop down and you can look at the information shown there by area development district. This shows some more detail, not at the county level, but in looking at the area development districts about those ER visits. Let's see. And we also have child fatalities and near fatalities on here. So some of the data we are, luckily, this isn't a data point that occurs often enough that we can show it at the county level. We have it here included for the state level as a whole. But you can see to the right that more than half of all fatalities and near fatalities are due to opioid ingestion. And as you look through the data, we encourage people to take a look, as I was saying earlier, where is your county doing well? What are strengths you can build on? And then are there areas where your county isn't doing as well? And are those places where you might be able to engage members of your community with ideas about what you could implement to change that, to turn those numbers around? Another specific example that I wanted to point out here is with the ideas for action. You can see here that there's a specific option that counties can implement to address some of the data points here. And this is around safe medication storage practices. So there's a link to the table, and with the table, you'll be able to get into more detailed information about how you might start going about putting something like that into place. Corinna, if we could jump to page 14 with the map. I mentioned that we have county examples of where groups are putting things into place to address the opioid epidemic in Kentucky. And these are examples that might spur ideas for you as a county. You can see on the left, we have 5 different categories. So we have programs that are reducing long-term harm, for example, some treatment programs that we highlighted, prevention programs, et cetera. A couple of these areas of impact can take a lot of different forms. One example in Graves County is the ASAP board, where they have young people involved in identifying the needs to focus on. The young people themselves are helping make those decisions about what the county and community should focus on in terms of substance abuse prevention. A different kind of example is in Kenton County, in the dark blue star, I believe, is the mentoring program that was established to support students. And this is one of those areas of examples of a positive childhood experience where you can have an impact on youth by helping make sure they have those positive childhood experiences that can balance out any negative experiences that they have. Let's jump to page 16 next. And this is the table that was referenced. With the table, you can tab through look at each section. These tables align, or the tabs align with the earlier pages of our dashboard. And with each of these, we have a description of a resource or program that could be beneficial in addressing one of the topics in the data. We also include information about how it aligns with Kentucky statute about how opioid dollars can be spent. And finally included on there are action steps, kind of like how you would get started if you were thinking about putting one of these ideas into place in your county. What's the first step? Who do you call? website might you go to get more information? So we wanted to provide resources to make it easy to kind of connect those dots. You find a data point that you're interested in addressing. We want to help and support in finding a way to address that and change that data point over the next 15 years while we have dollars available. I'm going to pause now and turn it over to Corinna, who is going to walk us through an example of kind of putting all of this together, how someone might approach the dashboard and use it for looking at their community. Thank you.
Thanks so much, Tara. And hello again to everyone. My name is Karina Kesh. I'm the Data and Research Director at Kentucky Youth Advocates, and I'm going to spend the next 10 or so minutes kind of giving an example of how you can use this data to identify areas of priorities and identify first steps of action items to pursue. So to get us started, I'm back here on page 2 of the dashboard, which is a table of contents. On this dashboard, you can see a snapshot of every page of the dashboard, including what data points you'll find on it. You can use this page to kind of identify interest areas and pinpoint where the data you want is. So for the purpose of today's example, I am interested in ways we can intervene in youth who are in the early stages of substance use. So looking through this table, I see there's a page called Early Identification and Intervention, which is perfect given my interest area. So I can click on it and it takes me directly to that page. So on this stage, we'll find or receive various data points around early youth substance use. This includes data on students reporting using opioids, drug offenses in schools, and drug offenses filed against youth. A couple of things I will point out before we look at this data. If you see any of the data on the screen and are wondering how it connects to opioid use, we recognize that not all of these connections are immediately obvious. So you can click on this light bulb up here and you'll see a pop-out come up, giving more context on what that connection between the data points and opioid use is. Similarly, if you're looking at this and you want to know where the data is from, what the data represents, or if there's any things you should consider when you're looking at the data, you can click on this dot by the data sources and it will pull up all of the source information. You can also find detailed data definitions and the full source information on the very last page of this dashboard. So in addition to the source and the year, something I want to point out is that you may find some data notes or additional context about the data. So for example, some of the data on this page is suppressed. That suppression is either because of the source that we got the data from didn't share it with us and suppressed it, or because we chose to suppress it due to there being just such a low number of events. So as you go throughout this data page, if you see an asterisk next to your county or your ad district or any of the data, that likely means that data was suppressed. Similarly, we put context for some of the data. So for example, on drug offenses filed for youth, all of this data reflects the county where the youth was charged, not the county where the youth resides. And throughout the dashboard, you'll find these contexts in this callout part. So now that we have kind of the basics on how to use the dashboard, we can talk more on how to translate this data to action. And for purposes of this example again, I will be using Barron County. Barron is in southern Kentucky in the Barron County Ad District. And on this page, we see that we have 3 graphs at the ad level and 1 graph at the county or 2 county level maps. So on this first map, drug offenses in school, we can find Barron County right here and see that it has a rate of 7.2 incidents of drug offenses in schools per 1,000 students. This number is better than both the ad district, which is 7.9 per 1,000, and the state, which is 10.9 per 1,000. So this tells us that Barron County is seeing less cases of drug offenses within their school system than their region and the state as a whole. If I go flip this map over to drug offenses filed on youth, however, we see a different story. In Barron County, there are 15.6 drug offenses filed against youth for every 1,000, which is double the rate of the ad district, which is at 7.7, and 3 times the state as a whole. So as I look at this number, this tells me that youth substance use is increasingly being dealt with within the court system. The court system can be a great place to connect youth with resources, but it can also have detrimental long-term effects on youth and increase their risk of future criminal justice interactions. So that's something to keep in mind. Finally, as we look over here to our last data point, we can see that the Barron County ad region has the third highest rate, with only Penny Ryle and Purchase ad having higher rates of students using opioids within the past 30 days. One note I will put on this opioid use is that this considers all youth opioid use, whether that's youth who are prescribed opioids after a surgery or youth who are using opioids recreationally. So seeing all of this data together, and especially this opioid number, you might be wondering, what does youth substance use look like for other substances? So we can go to page 7. And on page 7, we can get some additional context about youth substance use. So the first one we see is students reporting severe psychological distress. We can see based on the color that the Barron River Ad District has higher rates of students reporting psychological distress in comparison to other ad regions throughout the state. We can also go through here and see various substance use or various substances that youth might be using, and specifically if they've used those substances before age 13. So as we look at any tobacco use, which considers things like smokeless tobacco, vaping, and cigarettes, we see once again that Barron River is in that darker color, meaning that youth are using tobacco in this region at an early age more than other areas of the state. Similarly, we can look at alcohol usage and see that once again, the Barron River Ad District has high rates of youth using alcohol before age 13. Which once again, just that Penny Ryle and Purchase Ad District having higher rates. Finally, we can look at marijuana usage on this page and see the percent of youth using marijuana before age 13. And once again, we see that Barron River has a higher rate compared to other areas of the state. So what does all of this mean? Looking at all of this data as a whole, we can see that Barron River has a high rate of youth reporting mental health challenges, of early youth substance use, and that youth substance use in specifically Barron County is increasingly dealt with within the court system rather than schools. And we know the court system has one of the highest opportunities for those long-term adverse outcomes. So now that we've seen all this data, so we've seen that Barron River Ad as a whole has higher rates of early substance use, and Barron River has that higher rate of drug offenses filed. What do we do? So like Tara pointed out, we wanted to make this as easy as possible for counties to start thinking through and identifying action steps they can take to address these data indicators. So going back to this early identification and intervention page, we see that the idea for action is the Project Towards No Drug Abuse. This is a substance use prevention program specifically for high schoolers at risk of substance use, and it is taught by teachers or health specialists across 12 sessions or 4 weeks. Counties can support implementation in schools by covering the cost of training for those who will teach the program and paying for student workbooks. And if you want more information on how that works, we can click on that link and go back to that action table that Tara also showed us. And on here, we can see a brief description of what the program is, opportunities for intervention, which is that covering the cost of trainings and supports for teachers. We can also see how it aligns with KRS and therefore aligns with the use of opioid funds in the state. And then we can see action steps. So if you're interested in implementing this project towards no drug abuse, you can contact Leah or visit this website for more information on first steps in getting started. And with that, that's kind of how or you can look at this data, look at where your county is, look at where your region is, compare it to the state as a whole, and also identify what are some opportunities for intervention and what are the resources you need to get that started, whether that's the KRS to show to county officials so they know that it aligns with the use of opioid settlement funds, or just who to contact for support. And with that, I will turn it over to Lauren Carr.
Thank you all. And hi, everyone. And thank you so much for taking the time for this webinar and coming out. Like she said, my name is Lauren Carr, and I'm the Opioid Settlement Advisor for the Kentucky Association of Counties, or KACO. I work directly with county governments across the state to help them plan, spend, and report their opioid settlement funds that are impactful, sustainable, and rooted in local needs. One thing that I say, and it can be, I always say, is that you don't have to do this alone. These funds are a once in a lifetime opportunities, and counties are getting it right, and they are making real progress. They are collaborating. They are bringing in people from public health, schools, nonprofit, and importantly, people with lived and living experience that have been impacted by substance use disorder. So kind of what our county's funding, and then we can kind of go through this dashboard and how it can support your initiatives. So right now, everything is anecdotal. We do not have a front-facing reporting system for the state. It is being changed. We are the commission, which I don't work for the commission, but the commission is over the all of the funds. So 50% goes to local governments, and then 50% goes to the commission, and the commission grants out those funds. From that 50% of local governments, that could be counties or cities, and how they spend the funds, they have to spend it in accordance to the KRS statute and Exhibit E. So kind of what are we seeing in Kentucky? We have seen support for youth prevention programs and education, such as expanding Too Good for Drugs, Sources of Strength, or any other school-based program. So maybe they had it in ninth grade and able to pay for that curriculum, or helped a teacher get trained to teach it in say, the middle school setting. Recovery community centers have been a big area of interest for counties. They're kind of like a one-stop shop to help people navigate services such as peer support, job placement, housing navigation, and so much more. We have seen funding in harm reduction, such as quick response teams, naloxone distribution, and other things to reduce the harm of opioids. And we have seen counties fund jail-based treatment programs. So whether that is helping folks transition out of jail, any kind of reentry, treatment, housing, and jobs, we have seen that. And I want to share a couple real-world examples with you all. So, for example, Marion County has collaborated to become a Recovery Ready certified community. They've launched a youth prevention coalition and starting to engage youth at an early age. Christian County has been using their funds at their detention center to offer counseling and treatment to their inmates that were county inmates that weren't covered by state. For example, in Pendleton County, they are working with a local advisory board, launched an RFP process, and working with a grant evaluator to ensure accountability and track outcomes. Hardin County started a quick response team to engage people that have recently overdosed, and that came out of their overdose fatality review board out of the coroner's office. I think that was a really innovative way to look at the data and make a decision. And then Floyd County is partnering with their Family Resource Center to provide support for children and families that have been affected by substance use. These are all strong models. They're rooted in data, collaboration, and local planning. They're making decisions with the right people at the table, and they're measuring what works. So how do you, I saw there was a question in the chat, and I'll get to it, but how do we access this money? How do we get local officials to understand what opioid settlement funds are supposed to be used for, and how can we help people with these funds? I always share lead with local data. This dashboard is a great opportunity to start and pull a specific data point. For example, 40 and have this conversation with one of your local leaders. 45% of kids in the foster care system in our county were removed due to parental substance use, or our overdose rate is X per 100,000. Numbers get attention, and especially when they're tied to real community impact. And I share that um, because I come from a local county coalition, and so when that worked, when we were trying to bring this change happening, it is really trying to see what happens in our community, but also um, bring an idea, bring a solution. So that was my next point. Don't just present the problem. And opioid settlement funds are almost a different pot of money, different beast than county officials are used to. You know, they're used to animal shelters or paving roads or, taxes. They're not necessarily in kind on prevention or uh, behavioral health or anything like that. So also try to tie it to their priorities. Make it about the public safety and EMS and jail overcrowding, school success, and economic development. Show them how your area can reduce the strain on those systems and support a healthier county. And then also just bring a pilot idea, show an example from another county, and say, what would it take to try this here? And shift the conversation to from can we to how do we? And one example I want to share for that is in our community, we experienced an overdose. It was a couple years ago, but it was a prominent overdose. And we didn't have access to Narcan, and it was trying to elevate that conversation to let's see what we can do. Let's just try it. And so one of the first things we did was those little newspaper sandboxes, those Narcan distribution boxes. And it was an easy way to try it, to try to get that word out. And that has spread all over the state as a way to have community distribution of naloxone. So examples from the dashboard. How can we look at this dashboard and 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 use it to help you all? This is you can almost get a little overwhelmed by looking at all the data, but KYA has done an extremely great job, and we hope to put more examples of how the county investments of the opioid settlement funds on here. We hope to continue to share that. So if you're a county official or if you know that your program is being funded, please let me know. And we hope to share these ideas because we don't need to reinvent the wheel. What is working in one county might not work in another county, but it also might if you just change it. So let's work together. So for example, let's focus on kinship care. You saw in the dashboard, it talked about um, different levels of foster care, juvenile justice, and different things. Um, and in some counties in Kentucky, more than 50% of children are in out-of-home care and placed with relatives. These kinship caregivers are doing a lot with very little support. Many are retired on fixed incomes and navigating traumas that they weren't expecting. Some counties have used this data to guide investments, such as helping kinship care navigators access food, healthcare, or legal assistance support groups. One organization is doing a grandparents raising grandchildren support group and providing that assistance, direct support such as counseling and also school-based liaisons to help families get connected and engaged. When you show data and highlight the burden of kinship caregiving, pair it with a concrete idea. That helps build that compelling case, and it's exactly what a solution is. So, for example, you could say, we have this program that would help um, do XYZ, and have that conversation and really build that. I think that it's really great to start a pilot program to try to, we have this once in a lifetime opportunity to end the opioid epidemic with these funds, but how we come about it is all different. What I kind of wanted to um, wrap up and go is collaboration is key. So working with and we recommend advisory groups. So working with community leaders. So whether that is individuals from your local health department, community coalitions, school-based services, any kind of nonprofits to get everybody in at the table to have them support. But use the dashboard to create the conversation. It gives you the data and a reason to bring people to the table. And it's also might be eye-opening, like nobody wants to look and see that, the chronic absenteeism is so bad in one area. And so like, how can we help to fix that? And so also know that Keiko is here to help. Whether you are a local elected official, judge, executive, jailer, prevention provider, or even a parent, I'm here to support the efforts from reviewing spending plans to helping shape RFP processes or even thinking about what's allowed. We want to make sure that these dollars go to real, lasting solutions that strengthen our Kentucky counties. And I truly believe that staying focused on collaboration and compassion is the key that we're going to get there. Um, I kind of sped through that really fast. So if we want to go back specifically on the county um, dashboard portion, and I can talk a little bit about that. So right now, I had mentioned a lot of our data is anecdotal. So there is no public facing of how locals are spending the funds. And so these are examples from what Keiko has received, whether that be through meeting minutes or proposals or different things like that. And you can kind of see the areas. And what I hope to bring to this dashboard is also examples of how a county is providing recovery support, or how a county is funding treatment. And so that also helps. You can see what areas are being funded and what areas aren't. And so it also, the 5 areas, I'll break that down, is prevention, treatment, harm reduction, recovery support, and leadership and training. And so if you have any questions about that, Tara, I sped through that real fast, but I know that there were some questions in the chat. So if if we want to turn it over to questions, we can go there. I'm sorry.
I think that'd be great to look at some of the questions that came through. Um, let's see. I'll just read off one that we heard. So Tracy Nolan asked, are counties accepting grants with rolling dates until funds are spent, or are there specific deadlines? What is a typical grant amount requested? And what is standard rate for writing in the grant trainer cost per hour? And Lauren, as much of that as you're able to answer would be great.
Yep. So with the local abatement funds, they do not expire. So each county can spend it however they want. I would love, and we're kind of building this plane and flying it simultaneously. So I know that that's not a really good analogy, but there are some counties that are utilizing it with an RFP process. So for example, I know Harrison County, they had opened up their RFP process, and they were focusing on youth prevention. And so they were accepting grants until, I want to say, the end of June, and then they're going to start it with their fiscal year. It's all based on county by county. They don't have to be in a grant cycle or anything like that. It can be a proposal. It just has to pass through the fiscal court. So one of the things that I, will recommend is having not only that committee, but having a plan, whether that be, and I'll give an example of Lexington, Fayette County. Their advisory committee recommended three things to the governing board, and that was the first, they were going to do mini grant processes. So they were going to put some funds out for CBOs, community-based organizations, nonprofits to apply for. The second was going to put some funds in CDs for sustainability. And then the third was, I think that they were going to do a stigma reduction campaign within their county. And so that was what their advisory committee recommended to the council, to the board. And so that just gives a really, it's 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 based it's different from one to the other. I wish, and I believe I would love for us to be able to share, like whether it's regionally or county by county, but right now we don't have that information, and it's just kind of based on the county's preference. And what was the other question?
There's one from Steve Fowler on, is there a recommended percentage as to how much of these funds should go to youth prevention, PACEs, and/or positive youth development programs versus adult programs?
I don't think that there is a recommended percentage. I think that you need to look and see what your county offers. You can see what areas. One of the really good ways to do that is looking at that recovery community almost rubric, and you can kind of see the areas that you don't have for prevention, treatment, and recovery supports, and the areas that you do have. So you might be really heavy on treatment, and you might not need these local opioid dollars to go to treatment, where you might not have any youth prevention programs in the school. So where one area, and that's why it's really important to look at local data and see what is already happening in your community, and bringing all those partners together, because you don't want to fund something that's already being funded, but you also want to see the areas where you could grow. And also with these funds, the best practice is not to supplant. So if you were already paying for something, it's not best practice to use opioid settlement funds to pay for that. But what you can do is expand that program. And I'll give you an example, like in Christian County, they only had services for their state inmates. So then their county inmates that were coming in were not receiving those services. So they expanded it to their county inmates. So that's a way that they expanded services within, and not supplanting, supplement. And so they supplemented that program.
It looks like Tara gave a little bit of an answer, but if you'd like to expand on this, will there be a reporting form where counties and programs can brag about them to KCO? And then also where they can or do you want to know also what they're doing with county and city funds as well as state funds?
For this dashboard, yes. If you want to send me, um, and it's not a reporting form, but just kind of break it down in a little, uh, for a little example of what you're doing, we would love to share that out, whether it is the idea and actions with the little stars to have them connect directly to you, or just on that bigger map. Right now, we hope to bring more information to the public, not only to share this information of what other places are doing, but also to give people the confidence to know these are programs, these are fundable from the state level. The commission is implementing new reporting standards July 1st of this year. And so I will say that they are moving to a transparent process. So we will be able to see a lot more data and a lot more information for that. But if you want to send me, whether it be a star on the map and we can highlight that program, or just the full map and what area that is, we would love to do that.
Perfect. We still have a couple of minutes left. If anyone has any questions for the three of us, you can either put it in the chat or raise your hand and we'll get to them.
And I don't have a question, but I can continue to talk. I just want to also say, um, working in this field, so I came from working in community coalitions and then to our county governments, there might be a disconnect. You know, you might not feel comfortable, but have that conversation, use this data and lean on me if I can be of any support. You don't have to do this alone. There is so much information and resources out there and to really help people. Again, these funds are to help people and not hurt people. Almost all of us have been impacted by some form or fashion from the opioid epidemic. And, you know, a lot of us see this as blood money. And so we want to see this money go to programs and projects that really make an impact and have a lasting impact in our community.
I'm going to tag on to what Lauren was saying about not having to do this alone. So we did put the dashboard out there for you and hopefully shared some context about how you can put it into practice with your conversations that you're having in your community. But we are also offering technical assistance. And I know Krina was going to mention this later, but I just wanted to share a little bit more information about that. We're happy to make that work for you all in whatever form is best. So if you are let's say you're starting to have a community conversation and you want us to present or you want us to analyze, like look at all the data points and maybe pull out some areas where what we're looking at with the data shows maybe areas where you're doing really well and can build on that, or areas where challenges are occurring, kind of what Corinna demonstrated with Barron County. We're happy to do that for you. Or we're happy to facilitate a conversation where we kind of walk a team of you all through the process of doing that yourselves. So not us like kind of calling through the data and pulling out stuff that stands out to us, but kind of walking you all through a process of doing that. So we have flexibility to do that in person, online, or just have a discussion with you. And if you're at a point where you're wanting to dig into the data and maybe pull a group of people together and want some ideas on how to do that or what to pull out, maybe to get people's interest going by flagging some of the data points, we can do that too. So I think one of the takeaways we want y'all to hear is that we're here to help you all in any way that we can. So yes, we have this data up there. We hope everybody can just use it on their own as they see fit. But if you are interested in having some support and kind of making sense of it and how that might apply with what you know about what's already happening in your county, let us know. So as you can tell, those of us at KYA and Lauren with KCO bring different expertise to the table, and we're very happy to be partnering with them because Lauren has a lot of that on the ground information and insight we can support in other ways. So please reach out if you, after the fact, we did drop our emails into the chat, but let us know because we want it to be useful for communities, that we didn't put this together for our own satisfaction or interest. We put it together to make it a valuable tool for counties as they're making those decisions. I've shared at other presentations that my dad was a county judge executive for a number of years, and he would get calls on things like animals that Lauren mentioned. And so this can be very new to people who are in that, operating in that county fiscal court setting where they haven't had to think about prevention programs and youth development or mentoring or things like that, those positive childhood experiences very much. So tap in and we're happy to share.
Thanks for that, Tara. And I also saw another question come into the chat that I think, Lauren, you could probably answer, which is how much money has come to Kentucky so far? And are there still outstanding cases that might lead to additional funding?
So with the Kroger settlement, we're looking at a little less than $1 billion, over $900 million. Again, that is over a course of 18 years, and that's split 50-50. So 50% of that is going to go to the commission, and they are going to grant out funds, but 50% of that goes to local governments. And so it comes over a course of time. And I believe that with the new dashboard that the commission is creating in the new reporting system, we're going to see exactly how much has been in Kentucky, how much has been already allocated, and so forth and so on. And so that is all a process that has been taken. But and as far as pending litigation, I'm sure that there are some more pending litigation, but I don't know that. And so I believe that we will be talking about opioid settlements for the next several years to come.
And then one more question just came in. Does the commission offer grants with their 50% portion as well as local governments?
Yes, so the commission grants out their funding. Their funding cycle is not open right now. I believe it's going to be open in the fall. If you check our website, we partner with the commission quite a bit. So, for example, last year when they put their notice of funding out, we hosted a webinar for community-based organizations to apply for that and ask those questions. The commission is also, and I'm just going to be saying this, I don't work for the commission, but they check their website. I'll drop the website link in the chat. But they're doing a listening session, so they're setting their priorities this year. And so I believe it's July 8th. They're going to be down in Hazard, and so check their website and that is at their priority listening. So they set priorities. And then that priority is what they kind of fund. So, for example, last year was prevention and recovery supports. So, not so much on the treatment aspect because we do have a lot of treatment availability for Kentuckians, but really that support and family togetherness, I think, was another one. Thank you for putting that chat in there or that link in there. And yes, they do grant out funds, and we will be. And also, you can braid the funding. So if you get funding from your local government, you can maximize that impact, and that's what we try to highlight at Keiko is maximize that impact. So if you have a program, a pilot program, try to get that money from the state too. So you can help expand that. And I think that that's another way to have these dollars stretch longer. Yes, thank you.
Perfect. And then we probably have time for one more question if anyone has any. And if not, we'll also share our contact information for any follow-up questions that come. So I'll give it 1 minute to see if anyone has a question, and then we can close out if not. I am not seeing any questions come through. So with that, we can close out. It's in the chat. It's also on the screen, and we said it. But if you have any follow-up questions, if anything comes to mind later on, please, please, please feel free to reach out to us. We are happy to help and really want to make sure that you have all the information you need and counties have all the information they need to maximize the impact of these funds. Tara mentioned it earlier and Lauren shared the link in the chat. But if you found today's training helpful and want to bring this presentation or you want additional support for your organization or community to look through your county's data and identify action steps, we are available and would love to help you work through this either through community trainings or one-on-one technical assistance or helping to facilitate conversations. So Lauren shared that link in the chat. We'll also share it in the follow-up if you would like to request those. Second, Lauren also shared this in the chat, but we would love to know your thoughts on this webinar and how we can improve them in the future. So Lauren shared that evaluation survey. Would love if you filled it out. It should take less than 5 minutes to complete. And with that, thank you all so much again for attending today's webinar, and please reach out if you have any questions, and I hope we will see you at the next one.